Hello, my name is Rob Hernandez, and welcome to my newscast on patient wearables and technology. We've got a short amount of time, so let's just jump right into it. The assignment calls for discussing at least two patient wearables and mobile technology, and how what we've studied so far, the patient, the provider, the payer, and the population perspective. This particular perspective is mostly from the payer perspective, so I'll start there. This patient wearable is a pulse oximeter. This patient wearable device is engineered for those with asthma and who are at risk of congestive heart failure and COPD. The advantage is the patient is at home to continue extended monitoring of oxygen levels and pulse rates. From a payer perspective, it saves a tremendous amount of money because they're not having to pay for long-term clinic visits, overnight visits in the hospital, emergency room visits, and as well as the device is not that expensive. And in addition to that, it's great for the patient to be able to monitor these levels in the comfort of their home. And for the provider, because of the Bluetooth technology, they can receive these monitorings in real time. So this is great for a population who really needs this type of monitoring for these types of chronic conditions. And as you can see, it can be worn while you're sleeping or while you're active. The next type of wearable is worn by the provider, which is high-tech surgical glasses. And the purpose of this is while the oncologist is doing surgery, the aim is to be able to remove as many cancerous cells as possible. A fluorescent marker is injected into the patient, and a special lighting makes the cancer cells glow blue when viewed with this technology. So the lighter the shade of blue, the more concentrated the cancer cells are. So the payer perspective is that there's a tremendous amount of money and higher quality outcomes being paid because the potential is for fewer visits to the oncologist, surgeries, chemotherapies, because many cancer cells are caught early, and the physician is catching as many cancer cells with this technology, and the patient can rest assured that they have higher quality outcomes as a result. And this is great for a population that needs these types of surgeries. And then lastly, we have the mobile application. This is an example from my Cigna. This is great when you have to pay from a payer perspective, when you have to pay your premiums, your copay, and it shifts the consumer health back to the patient because the patient's now in charge of setting up appointments, monitoring their blood work or their test results that come in. The provider can send them off to a electronic health record that can be monitored through this type of technology. So this is great for this population that really likes to be in control of their own healthcare, consumer-driven healthcare. So there we have it. Thanks for listening and appreciate your time.